Salicylic acid 10% topical liquid is used on the skin to treat common skin and foot warts. It helps the wart to gradually peel off and can also be used to remove corns and calluses. However, it should not be used on the face or on moles, birthmarks, warts with hair growing from them, or genital/anal warts. Salicylic acid belongs to the same class of drugs as aspirin and works by increasing the amount of moisture in the skin and dissolving the substance that causes the skin cells to stick together. This makes it easier to shed the skin cells. It's important to note that salicylic acid does not affect the virus that causes warts. The recommended daily dosage and optimal timing for using this medication should be discussed with a healthcare professional. Make sure to follow all the directions on the product package. If you have any questions, ask your doctor or pharmacist. This medication is meant for use on the skin only. Avoid getting this medication in your eyes, nose, mouth, groin, or on any broken skin. If it does come into contact with those areas, flush with cool water for 15 minutes and wash your hands after use. If you're treating a corn, callus, or wart, soak the affected area in warm water for about 5 minutes, then dry thoroughly. Your doctor may instruct you to use a pumice stone, callus file, or emery board to remove the top layers of dead skin before applying the medication. This is to help the medication work better, but do not try to rub the wart or callus off. For liquid/gel medication, apply a few drops or a thin coat to cover the entire affected area. Let it dry for 5 minutes, and depending on the brand, you may need to apply the medication twice per treatment. Check the product package for specific directions. You may cover the area loosely with a bandage. Repeat this procedure 1 to 2 times daily for up to 2 weeks for corns and calluses, or 12 weeks for warts, or as directed by your doctor. If you're using a medicated pad or bandage, make sure it covers the treatment area completely without touching the surrounding skin. Follow the package directions for how long to leave it in place and when to replace it. Repeat this procedure for up to 2 weeks for corns and calluses, or 12 weeks for warts. The dosage is based on your medical condition, product type/brand, and response to treatment. Do not use large amounts, apply more often, or use it for a longer period than directed, as this won't make your condition clear faster and may increase the chance of side effects. Use this medication regularly at the same time each day to get the most benefit from it. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. When using salicylic acid 10% topical liquid, you may experience some minor side effects such as slight burning, skin redness, and peeling. These effects are normal and expected, but if they worsen, be sure to inform your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the risk of side effects. Most people who use this medication do not experience any serious side effects. However, if you notice spreading skin redness, signs of infection, or the formation of a deep sore at the treatment site, contact your doctor immediately. In rare cases, a serious allergic reaction may occur, so seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, make sure to consult your doctor or pharmacist. As for the best time to use this medication, it is recommended to follow your doctor's instructions and use it as directed. Be sure to discuss the daily dosage and optimal timing with your healthcare provider to ensure the best results for your specific condition. Before using salicylic acid, make sure to tell your doctor or pharmacist if you have any allergies, especially to nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin, ibuprofen, or naproxen. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to talk to your pharmacist for more information. Don't forget to inform your doctor or pharmacist about your medical history, especially if you have diabetes, poor blood circulation, or any skin infection/irritation. If you are going to have an MRI test, it's crucial to let the testing personnel know if you are using the patch. Some patches may contain metals that can cause serious burns during an MRI. Ask your doctor for guidance on whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. If you are pregnant, only use this product when clearly needed, and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this product if you are breastfeeding. It's important to be aware of potential drug interactions when using Salicate 10% topical liquid. This can affect how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Salicate 10% topical liquid. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty in breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. It is crucial to take this medication as directed and to seek medical help if any concerning symptoms or side effects occur. If your doctor has prescribed Salicate 10% topical liquid for you, it is important not to share it with others. This medication is used to treat a variety of skin conditions, such as acne and dandruff. It works by causing the skin to shed dead cells from its top layer and slow down the growth of skin cells. This effect decreases scaling and dryness. Apply a thin layer of the medication to the affected area and gently rub in, usually 1 to 3 times a day or as directed by your doctor. It is best to use this medication at the same time each day to help you remember. Be sure to wash your hands after applying unless you are treating the hands. Do not apply this medication to the face, underarms, or groin area unless directed by your doctor. If you are using the non-prescription product to self-treat, read and follow all directions on the product package before using this medication. If you forget to use Salicate 10% topical liquid, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't use double the amount to make up for the missed dose. Use the next dose at your regular time. When it comes to storing Salicate 10% topical liquid, it's best to keep it at room temperature. Different brands may have different storage requirements, so be sure to check the product packaging or ask your pharmacist for specific instructions. Always keep medications out of reach of children and pets. And when it comes to getting rid of this product, never flush it down the toilet or pour it down the drain unless you're told to do so. When the product is expired or you no longer need it, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.